Welcome to the Eyefinity EHR Supplemental video on the Patient Portal. My name is Rhonda and I'm a training specialist for Eyefinity. In this video, we will cover how to log in and use the portal, reconciling the Patient Portal from the browser, and reconciling the Patient Portal on the iPad. The patient uses the same web address that you as a practice use to log in. They will log in with the username and password you assigned, or the username you sent them via email, along with the password they set up for themselves. Once logged in, it defaults to the contact info. At the top, we'll see the patient image or photo if taken from the iPad, the patient's name, their date of birth, their age, their gender, their practice management ID number, their last dilation date, as well as any alerts or allergies that were documented. The down arrow expands the view where they can see the preferred provider, primary care provider, referring provider, their insurance information, their primary address, pharmacy, and contact method. If a sticky note had been created, the patient will not have visibility here for that sticky note. Under the My Contact, the patient will see their basic demographic information. They will not be able to change any of their personal information, as this information lives within your practice management. They can change their language, their race and ethnic group, and their preferred contact method. The email will populate only if added in your practice management system, and it will not be able to be changed here. The portal works the same as if you are logged in. The patient can scroll all the way to the bottom and select Save or Save and Continue, or they can simply navigate to the next section on the left and it will auto-save their changes. Insurance and Pharmacy is a patient view to see any insurances they have assigned to them. They cannot change or add insurance here. That information must be updated from within your practice management system. The pharmacy at the bottom will show any pharmacies assigned or allow them to add a pharmacy to their account. The functionality is exactly the same as you use to add a pharmacy to their account. The next several tabs are going to update the clipboard for the patient. Medications shows all meds assigned or allows them to add a medication. The patient adds the medication the same way as you would if you were entering the medication yourself. They would search for the drug name and document their medication. So maybe here they want to add vitamin C. So they can start typing in vitamin and they can review here any additional information. So we'll look through the list here, we'll select this vitamin and we'll select a tablet. They also have the ability to remove medications. So if this patient were to remove the allergy med, they'll be able to remove it here, but you will have to approve it on your end in order for it to be completely deleted from their account. Under allergies, same thing applies here. They can search and add allergies. They again will have the ability to delete information, but it has to be approved on your side. Past medical history. Here, the patient, maybe they've just recently been diagnosed with asthma. They can select asthma and document that. Maybe they've not had any surgeries, so they select none here. Okay? Now, notice that it did give them an error because someone has already documented something here under the surgery. So there are warning windows that will stop the patient from making changes. Ocular history, same thing. We can look through here, review any of this information. Social history, they have this patient as a current everyday smoker. Well, he's 16, let's hope he isn't. So maybe that was a mistake, and the patient changes that to never. Under family history, They can search here for the family history, or they can document information under Other. And then you can document that information in the appropriate areas when you're going in and reviewing this history. The problem list will provide all diagnosis and findings that have been documented for the patient. The blue information bubbles under the Learn More tab will provide education to the patient about that item. So for example, if I were to click on the Other Chronic Allergic Conjunctivitis, we can click on that, and this is going to bring up a script guide and give the patient more detailed information regarding conjunctivitis. The Visit Info tab at the top has My Health and Testing Results. My Health defaults and shows all the visits recorded for this patient. It's going to list the visit date. It's going to show the provider and the staff member that worked that visit. It's going to show any impressions that were documented, the facility, and also an action. A visit date that has a blue hyperlink means that this is a finalized visit. If the date is black, this is still a preliminary visit. When a visit has not been finalized, the patient will not be able to see all their visit information. They will be able to click the blue hyperlink under the action that says Patient Education, and they will be able to view the same list that we just looked at on the Patient Info tab on the Problem List section. Again, they can click the blue bubble link to read more information pertaining to the items on the list. The visits with blue hyperlinks are finalized. Under the Action column, there are additional choices. They can send a continuity of care document. They can view a continuity of care document. They can download that, and they can also download it in an XML. They can click on the blue hyperlink for the visit, and this will actually pull up the visit note. So here they can see all the information that was documented for their visit. They can view the encounter form, which is the billing justification. They can view education, which would be counseling statements if they were documented, and also the patient education. So again, here are those blue bubbles. So there's 3 different ways that we can review their problem list. The Tests and Results tab will document any tests and results that you documented, but only once the visit has been finalized. The last section at the top is Contact Us. This is how the patient can send an intramail to the practice. They would click on New Message. In the To field, they would select who they're sending this message to. So maybe we're sending it to the front desk staff. They can carbon copy an additional person. They would document a subject and a message, and then they would select Send. In the upper right hand corner, the patient can also reset their password, and when they're finished, they would simply log out. When the staff or doctor log into the system, there's a couple ways that you can review to see if your patient has used their portal. How do we know if the patient updated the clipboard using the portal? One way to tell is from the patient's chart. Select the drop-down arrow on the patient banner to expand the view. Under Portal, there will be a last login. So here we can see the patient last logged in on February 8th of 2017. The other way is through the clipboard. So if we navigate into the clipboard, under the Past Medical History, we see that there is a Reconcile with Patient Portal button. So if this button is here, that is your indicator that the patient has updated their medical history on the portal. If we select Reconcile with Patient Portal, the sections that were selected through the portal will appear in green. You can accept or deny these changes. It appears the patient has added asthma as their new medical history. when we select Show Amendment History, this will also show what has been reviewed and changed through the patient portal. So here it says Status Pending, Past Medical History, the patient added asthma. So I'm going to go ahead and choose Accept. And we'll now see that asthma has been added to this patient's history. So if we go now to Ocular History, we'll notice here that there is not a Reconcile with Patient Portal button, which means that the patient did not update anything. We could also look at Show Amendment History and it says no records found. If we go to Medications, we do see the Accept or Deny, so there isn't a Reconcile with Portal. It automatically shows that something was added here. So we can accept or deny. So remember, I told you when we were reviewing the portal and what the patient sees, they have the ability to delete medications. This says medication added. If something were deleted, it would show that over here, that a medication was deleted. Or if something was changed, it would show that it has changed. So if you choose accept, you're accepting everything they changed within that portal. So if they added a med and maybe deleted a med, and you choose accept, that medication will disappear. So you have full control over those patient changes. I'm going to go ahead and select accept. And we're going to move to allergies. Okay, again, we don't see that anything here was updated. We could say Show Amendment History just to double check. Social History, Reconcile with Portal, which lets us know a change has been made. So we'll select that. We'll notice here the patient changed from current to never, and we can accept or deny that. And the same thing with the family history. Reconcile with Portal, if any changes were made. Notice all this information under Other, where technically we want to be searching for that history and adding it from here. So we could then just simply click up here and accept that. But then what we would want to do is come up here and search and add those in as actual menu items. So we'll say diabetes, and we'll select grandfather. And then we would come down here and take that out. And then add the others the same exact way. Once you're finished, since we're on the family history, we'll go ahead and save that since that is the last tab. And we've now just updated and reconciled everything that was changed from the portal and added it here to the patient's account. How do we know if the patient updated their clipboard using their portal? If we navigate to the clipboard, each section will have Amendment, Reconciliation, and History. So if we touch Amendment, Reconciliation, and History, a window will open and list what changes were made through their portal. So here we see that the patient added anxiety and removed none. We can choose Deny or Approve for these changes. If I touch Approve, you'll notice now that anxiety does have a check mark and it shows that those amendments have been accepted. If we navigate to Ocular History, choose Amendment, Reconciliation, and History, we'll notice here that no changes were made. If we go to Medications, automatically it shows us what was changed on the portal. So the same thing goes here. We can approve or deny those medications. Notice the patient did delete a medication and they added a medication. So if a medication is deleted and we choose Approve, that medication will no longer be on the list. So it's up to you if you want to keep medications on the list so that you have a history of what this patient was taking. Then you would want to write down what they added and deny the change here. I'm going to go ahead and approve this. We'll see it's been changed. Now apparently that patient deleted the med because it was listed on here twice. You can go in and add additional medications if the patient forgot to add something. If we navigate to allergies, Nothing was really changed here. We can do amendment, reconciliation, and history and see that nothing was changed. Social history, again, amendment, reconciliation, and history. The patient did add none under social history, so I'm going to go ahead and approve that. And move on to family history. Again, I can choose amendment, reconciliation. No changes were made here. So even though the patient has made changes, you do have complete and total control of what updates into your system. When you're finished updating the portal information and adding anything additional here to the history, select Save in the upper right-hand corner.